Good morning, everyone. Welcome to Revere City Hall. We are here today to officially mark the start of an agreement between the City of Revere, the City of Chelsea, and the Town of Winthrop that will make our communities stronger and healthier. Today we are officially ratifying the North Suffolk Public Health Collaborative, which will allow our three communities to work together to identify and address public health needs. This regional public health collaborative will also work cooperatively with many of our healthcare providers in our area as we tackle our chronic public health issues. I want to start by thanking a number of people who are in attendance today. I want to acknowledge first Winthrop Town Manager Jim McKenna, Chelsea City Manager and former Mayor of Revere. Welcome back to the beautiful chambers, Tom Ambrosino. Our state delegation, we have Senator Boncory here and representatives from Speaker DeLeo's office, and especially want to thank our delegation because this collaborative is part of the district local technical assistance that override that you've done in the past, and the MAPC staff has worked so hard to make sure that we can come together today to sign this agreement and really work on our public health issues. And so that DLTA assistance and funding is imperative going forward in these regional collaborations. The collaborative will work closely with our existing public health coalitions in our communities, and by doing so, the collaborative will ensure successful public health efforts across municipal lines and making sure that we're not needlessly duplicating effort. The three communities, Winthrop, Revere, and Chelsea, share similar public health challenges. Residents of our communities have higher than average rates of asthma, heart disease, diabetes, and substance use disorder. And so by working together, we can better identify the causes of these issues and work towards a solution, which is obviously the most important part. And so in collaboration with the Metro Area Planning Council, whose help has been the driving force for the past 6 years in making this happen, our three cities are putting together a plan to hire a public health coordinator that will oversee all relevant community health work. And this coordinator will represent our communities both on a regional and statewide level. I look forward to our continued partnership with Chelsea and Winthrop, and as we work together on public health and hopefully a number of other regional issues. And personally, I want to thank Manager McKenna and Manager Ambrosino for being, as the youngest and newest member of this regional collaborative, for being the high standard of public servants that you are, and really you end up being kind of mentors for me. So I appreciate the time and energy and effort that you've put into helping me be successful in my position, and look forward to a great working relationship. Thank you.
You know, I think, if I'm not mistaken, Manager Ambrosino has had several career changes since we started this. We started talking about this 6 years ago, and I think I have to tip my hat to Jay Ash, because he was the first voice that stepped in to say, you know, we ought to be doing this together. We ought to be talking about public health together, because public health concerns know no municipal boundaries. We were quickly realizing that we had a number of issues together that needed to be thought through, and that we should not be on our own, as it were, trying to fight some battles that are particularly onerous and particularly difficult. And Chelsea was leading the way at the time with a very strong health needs assessment. And I think Leslie Aldrich is here, right? Hi, Leslie. You know, we partner with a lot of folks, Mass General, North Suffolk Mental Health, a number of organizations that have really carried the ball in the region for dealing with some very difficult issues. But beyond that, we realized that at the local level, we need to start beginning to formulate strategies that we can leverage, that we can learn from, that we can talk about as a community, because so much of public health goes undiscussed, if you were, at the local level. I know I see our chairman of our Board of Health here, Nick LaConte, you know, and the challenge of talking about public health is a challenge. And making a community understand its responsibilities and what it can do to deal and address public health challenges needs to start happening on a more broad dialogue. And we started doing that in Winthrop. And Jay came over one day and sat in a couple of our meetings and realized how important it was to have those conversations. And we reached out to then Mayor Ambrosino, and he began talking about this idea of collaboration at the local level, in large part because we saw the North Suffolk region actually not being as competitive as it could be at a couple of levels, particularly at some funding levels at the federal level. And so we came to the conclusion that we needed to figure out how to work together and how to join forces and create a team approach to addressing some of these issues. And as a consequence of that, I think we held the first regional discussion about opioids back in 2010. Some of you were there at the Kowloon restaurant when Speaker DeLeo, I think, led the discussion about opioids. And that began, I think, a broader conversation about how impactful that particular issue has been to all of our communities. And as a consequence of that, we learned that we needed to recognize it for what it was and to develop some strategies to deal with it. I just got word this Friday that Winthrop's holistic strategy for substance abuse is going to be recognized in Atlanta at the National Conference of Substance Abuse in April. That's amazing. That a small town like Winthrop can have a seat at the table to discuss a nationwide concern. But that's the kind of stuff that can happen when you work at these things and you work at them together. And that's what our hope is here. So there's a lot of promise and a lot of potential for us in this collaboration. And so we really wanted to make it happen. I can't ask for better partners in Chelsea and Revere. We are partnering on a number of other areas, but we saw this as a natural space for collaboration. I want to thank the MAPC in particular for the driving leadership that you've given to this. You're a wonderful resource for our communities. I want to thank our delegation, the speaker, who has been out front on these issues from day one, and our Senator Boncori here, and everyone that knows how important these issues are. This really is going to be, I think, a great opportunity for all of us to find the space to talk about tough issues and to deal with them together. Because I think together we can come up with some very good ideas and actually realize some gains in this difficult arena. So with that, I'd like to ask Manager now, Ambrosino, to come up and say a few words.
So thanks, Jim. I'll be brief. I mean, regional approaches work. I mean, we've seen the success that we have had as a region in trying to address the opioid problem. And I know there's been a lot of attention paid to that issue, a lot of state resources put to that issue, and we've had a great deal of success. We certainly haven't solved that problem by no means, but I think our regional approach to that problem has really worked well, and we've been able to develop some good strategies for attacking that problem. There are lots of other public health issues out there, however, that don't have the same attention. I mean, we have them in Chelsea. We have asthma problems. We have obesity problems. We have this huge problem of mental health issues and trauma among our school-age population. A terribly vexing problem that we're grappling with in Chelsea, which I know, if it hasn't come to Winthrop and Revere, it's on its way. And we need regional approaches to deal with that problem because we can't do it alone. And so I'm very hopeful about this new collaborative. I think it'll allow us to not just pool resources, but develop some good regional strategies and to start to make the sort of progress in some of these other problem areas that we have as we've made with the opioid problem. So I'm very much looking forward to seeing this come to fruition. As Jim said, it's been a long time in the discussion phase, and I give credit to Mayor Arrigo because he really made it a priority when he first came in to bring this to fruition. In fact, right away, I just want to mention we are, one of the things that we will be helped by virtue of this collaboration is being more competitive in getting grant dollars, and we are now about to submit our first grant opportunity together, and I think MAPC will say a little bit more about that. But those are the kinds of things that a collaborative makes more possible. It's a lot easier to gain grant dollars when you're going in as a collaborative of several municipalities than on your own. So with that said, I just want to say I'm really excited about this new collaboration, and I'm sure it'll be as successful as some of our past collaborations have been. Thanks.
Hello, everyone. I'm Nick LeConte. I'm the chair of the Winthrop Board of Health. It's really great to be here today for this momentous event. It kind of feels a little bit more like a family reunion, and that's because up until 1846, we were all part of the same community. Today, we rejoin together to synergize our expertise in a local service that is unlike any other, elevating the health of our residents. And unlike other local services, the challenges we face in health, the opioid crisis, of hoarding, of just plain making sure that seniors can get to their doctor's appointments, of keeping our people healthy, they are the exact same challenges our neighbors across the street in Revere and Chelsea face. And we are stronger, we're more efficient, and we're more able when we face those challenges together. I'm also struck at the timeliness of this community reunion because I've been thinking a lot about the sort of startling news at the federal level from last week. And I've been thinking a lot about how it's important for us communities to stand together, that we watch out for each other in this time, and that we remember that we will always get further when we walk together, and that it's right here at the community level where lives are the most impacted by what we can provide to help people. And that's why I'm really grateful that our three communities are rejoining forces after 150 years apart or so, and to do the most good for the most amount of people that we can in the area of health. And thank you very much.
just had a few more words to say about. But yeah, I mean, just before we conclude, we just wanted to make a mention of where we go next with this, because obviously this is a great day, and after a lot of work and a long time of discussion, we are now able to sign this agreement and see it come to fruition. But we also want to make sure that the collaborative is successful. So one thing we are doing together with the communities is actually today we are submitting an efficiency and regionalization grant to the state. And that's going to enable MAPC to continue to work with the 3 communities to get this thing off to as good a start as we can. And I guess a number of the things that we're going to be trying to do is, one, as people have mentioned, we want to hire a good coordinator, somebody who's going to be able to make this work and really collaborate with all the other public health stakeholders across the subregion. So MAPC, we're going to help get that search started, working with the communities to do that. We also want to develop the collaborative's initial public health priorities as well. Review some of the existing community health assessments and available public health data, things that MGH and others have already put together, and start to really build the building blocks of what the work plan is for the collaborative going forward. We also want to really engage those community stakeholders, get them at the table and see how we can bring them into the tent so they can play a role in getting the collaborative moving. And the last thing we want to do is really get the collaborative's board structure together. And I think what is somewhat unique about this is, I mean, we have the chief executives, they're the ones who are going to be active and engaged in this. And I think that's really important, because these type of initiatives really, they don't work if you don't have that level of leadership at the table. And I think we've see today that we have that. And I think, the board structure, is something that they're going to be a part of in making this work. So, we're going to, hopefully we get that grant. If we don't, we're going to still play a support role no matter what. We want to see this succeed, but hopefully we do, and that will enable us to kind of do as much as we can to get this initiative rolling. So really great thank you to everybody who's made this happen, and we hope to continue to work to see it succeed. Thanks.